Hi, I'm Selena Valenzuela, and this week's patient is a patient I saw in the OB clinic. She said she's here to follow up on a pregnancy test that she took at home. She says she feels nauseated and like she's vomiting a lot, just like her last pregnancy. This patient is a 22-year-old G2P1 Hispanic female and states she's been experiencing nausea and vomiting for the last last few weeks. The patient states she's had same symptoms with her last pregnancy. She said that she received her prenatal care at this clinic for her first pregnancy, and she's been coming here for regular visits. She presented to the clinic today at 7 weeks pregnant by her LMP. She said she had a positive home pregnancy test 2 weeks ago, and she said that she can keep a few things down, but she vomits 2 to 3 times a day. She reports that she's in overall good health and doesn't remember being sick often as a child. She states that the second time, or this pregnancy, she knew she was pregnant as soon as the nausea and vomiting started because this is what happened to her with her last pregnancy. As soon as she was nauseated, she took a home pregnancy test, and so she thought as soon as she started feeling nauseous this time and had missed a period, she would take a pregnancy test, and it turned out positive. She said that she had a normal vaginal delivery, her last pregnancy, of a healthy 7-pound, 5-ounce baby boy. He is 3.5 years old now. She said that her delivery had no complication and says that although she had nausea most of her pregnancy, she was able to get through it with small meals, occasional medication, and sometimes she would just try to keep some fluid or crackers down. She has no known drug allergies or food allergies. She denies any past surgery. She's not on any kind of medications right now. She's up to date on her childhood vaccinations, and she just had her flu shot last week. She denies any kind of psychiatric history. Her social history is that she lives with her boyfriend and 3-year-old son. The patient is a part-time employee at Walmart, and she denies any recent travel or exposure to anyone that is sick that she knows of. She denies any history of smoking, drug abuse, alcohol use, or tobacco use, or e-cigarette use. She says she doesn't eat the healthiest, but she tries. Right now, she says that she's just been eating a lot of soup and crackers and trying to keep that down. Her family history: her mother's healthy, her dad has diabetes, and her maternal grandmother has hypertension. She has one sister who's younger and says she's healthy. Her sexual history: the patient says that she's had 2 partners in her past, besides her current boyfriend of 2 years. She states that she has used condoms for birth control because birth control pills make her feel nauseated. She became pregnant with this pregnancy using condoms for birth control. Her review systems: she denies any feelings of nervousness, anxiety, depression, suicidal thoughts, denies any fever or chills. She has no rash, lumps, sores, bruising, denies any easy bruising or bleeding, cold intolerance. She denies any headaches or dizziness, no pain or epistaxis or nasal discharge, denies any complaints of a sore throat or cough, no syncope, weakness, numbness, tingling, reports feeling tired and sleeping longer than she has before. Cardiopulmonary: she has no shortness of breath and no complaints of chest pain or palpitation. There's no pain or change in her bowel habits. She does report that she's been nauseous and vomiting for the last few weeks. She reports no vaginal bleeding, has not noticed any abnormal discharge. She has regular periods every 28 to 30 days, lasting 5 days with medium flow. And she's a G2P1. By her last menstrual period, she's 7 weeks. She had a normal, uncomplicated vaginal delivery for her first baby. Her pre-pregnancy weight is approximately 160. She is sexually active, has had 3 male partners. She has no history of sexually transmitted diseases. The patient reports that she's had negative pap smears. Her last was a year ago, denies any sexual abuse or being molested. Her objective, her vital signs are all within normal limits. Her BMI is 27.5. Her skin is natural in color. It's warm, smooth, and dry. Um, her head is normal. Her hair is normal texture and equally distributed. Her eyes, her extraocular movement is intact. Her conjunctiva is pink. Her nasal mucosa is pink and moist. There's no redness or swelling noted. Her cervical area has no lymph nodes palpable, no enlarged thyroid. Her trachea is midline. She's alert and oriented. Her chest is symmetrical. Her respirations are even and labored. Her lungs are resonant. Her breath sounds are clear. Her heart rate is regular. Extremities are warm and dry. No bruising noted. Her abdomen is soft and rounded. It's non-tender. She has normal active bowel sounds and no palpable fundus. She has normal female genitalia. On speculum exam reveals no lesions in the vagina or cervix. Small amount of white discharge noted without odor. Bimanual exam reveals an 8-week size uterus with no masses palpated. Her differential diagnosis is viral gastroenteritis, food poisoning, or pregnancy. Most likely diagnosis is pregnancy. The plan is to confirm her pregnancy with the urine HCG. If her pregnancy test is positive, then she will need first trimester labs, which include a CBC, a blood type, RH, an antibody screen, a urine test, rubella screen, syphilis, gonorrhea, and chlamydia screen, Hep B virus surface antigen, and an HIV antibody. For her nausea and vomiting, the patient was educated to try to take in oral fluids, soup and crackers, small meals, jello, and see if she's able to keep those things down. Pregnancy related, if her pregnancy test is positive, then we're going to draw her labs. We need to schedule her next visit. She's going to need a first trimester ultrasound. Talked about her diet, small frequent meals, toast, crackers, water before getting out of bed in the morning, and maybe try some ginger tea. Other patient education given was to develop with a treatment plan would be developed based on her labs. Education about nutrition and fluid intake, substance abuse, smoking cessation, alcohol contraindicated, caffeine less than 200 milligrams, appropriate weight gain and exercise, and ensuring food is properly cooked, prenatal vitamins, and 400 micrograms of folate. Patient verbalized understanding of the education. If her pregnancy turns out negative, then we would reevaluate and see what else could be causing her nausea and vomiting. Okay, thanks for watching. Bye.